Good afternoon everyone. I am Mrs. Karthika, one of the nursing supervisor at GEM Hospital. Today we are going to discuss about the topic on liver transplant and the post-operative management of a patient after liver transplant. So, as an introduction, liver transplant treatment is a treatment option when the medical management fails for a patient with liver failure, and then we will move on for a liver transplant. So, in liver transplant surgery, the old liver, that is the damaged liver, is removed completely, and a part of new liver, that is a healthy liver from a donor, is attached to the same place. So, regarding the concept of liver transplant, this is a donor and another is a recipient. From a healthy donor, a part of liver, that is most probably the right liver, which is the big lobe, will be transplanted to a patient who is a recipient. Then there are two types of liver transplant surgeries. First one is DDLT, that is deceased donor liver transplant, and the second one is LDLT, that is live donor liver transplant. In deceased donor liver transplant, we are taking a part of liver from a person who underwent brain death, and that part of liver will be attached to the given to a recipient. In live donor liver transplant surgery, the most of the time the patient's relative will be the donor, and a part of liver will be given for the recipient. So, most of the time before the liver transplant surgeries, the patient will be concerned about the following things, like is it safe for donating a liver? So, it is really safe for donating a part of liver. Only a part of liver is taking, so it will grow like a nail or hair. So, it will regrow again. So, there is no concerns regarding the safety. And donor surgery can be done through a laparoscopic approach or robotic surgery, in which our hospital we are practicing like that. So, regarding the cost of liver transplant, it is about 18 to 20 lakhs, where Chief Minister funding is available. All the things like the surgical as well as the medical part will be taken care by the Chief Minister fund, and crowd funding also can be done. Then who can be a donor? In this case, it is really for live donor liver transplant, that is only relative can be a donor. In case of deceased donor liver transplant, we cannot say like that, because of some legal issues, we are suggesting like only relative can be a donor in case of live donor liver transplant. And regarding the blood group, it is a positive or negative, that doesn't matter, but these are the criteria can be followed. In the left side, it is the donor, and it is the recipient, and the right side, it is the donor. The treatment option for liver failure cases can be medical management or surgical management. When a medical management fails, we will go for surgical management. Today we are going to discuss regarding the surgical management. So, when to do a transplant? Do you ever seen like this scores, like 𝗀𝘃𝒃 score or MELD score? Have you ever heard? Yes. Okay. Let's discuss that. So, when a patient with a 𝗀𝘃𝒃 score comes under B or C category, will be go for a liver transplantation. And if it is a MELD score more than 40, if the score is, then we will go for the transplantation. So, this is the 𝗀𝘃𝒃 score, and these are the things we will assess during the for calculating the scores in 𝗀𝘃𝒃 score. And in MELD score, this is a formula for calculating the MELD score. If it is more than 14, we will go for liver transplant. And in our hospital, and nowadays we are using the MELD score. Then regarding waiting for a liver, it is in case of deceased donor liver transplant surgeries. So when a person accepts as a transplant candidate, the name will be placed on a national transplant waiting list. Then most of the people need to wait for a long time for getting a new liver. Then when the liver is available, when a person is died or brain death happened, it will be notified, and the who need urgently the liver will be placed on the upper side of the list, and whose necessity is little bit lower will be in the downside of the list. Then accordingly they will allot for the patient when the new liver arrives. Then the patient will go to the hospital and get admitted and will plan for the surgery. When waiting for a liver, for a live donor liver transplant, when a living person is donating a part of the liver, most of the time it is planned in advance. So the recipient and the donor will have surgery at the same time in same hospital, and the donor must be in good health condition and have the matching blood type which is to the recipient. And the donor will also take some psychological tests for knowing that whether they are really ready for donating a liver. Then the infection prevention practices before transplantation. We have to follow certain infection prevention practices, so that are screening of donors and recipient. The complete system assessment will be done for both the donor as well as the recipient. And the treatment for pre-existing infections. If the patient is having any infections, that has to be completely cured before planning for the surgery. And avoid use of blood products, because after the use of some blood products, there is chance for getting hepatitis B and all. So we have to avoid all the kind of blood products or blood transfusions before the transplant surgeries. Then immunoprophylaxis, it is all regarding the vaccinations. All kind of vaccinations the patient should undergo, like hepatitis B vaccine, flu vaccine, everything. Then regarding the surgery, it is a major surgery which will take about 6 to 12 hours minimum, and patient will be in supine position throughout the surgery, and the surgery is done under general anesthesia. During the surgery, the damaged liver is completely removed and a part of new liver is replaced. Now we will look on to the liver transplant team. Who all are the liver transplant team? Then that is transplant surgeon, transplant nurse coordinator, clinical pharmacist, transplant hepatologist, physiotherapist, intensivist, anesthesiologist, radiologist and dietitian. It is a teamwork. And nurses is the backbone of all surgeries. During the preoperative period, we have to arrange for minimum 10 units of filtered packed cell, 10 to 12 units of fresh frozen plasma, 1 unit of single donor platelets. In liver transplant surgeries, only we will use single donor platelets, and 4 to 6 units of cryoprecipitate. During the surgery, the patient is in supine position, will wear a stocking, and patient will be lying over a full body warmer, and a head gel and foot gel pad will be placed, and the room warmer will be there inside the OT. The catheters and tubings which will be inserted during the surgery includes an IV line to deliver fluids and medicine, a CBC, that is to monitor the blood pressure and for taking blood samples, and femoral artery line, and an ET tube to ventilate the patient during the surgery for giving mechanical support to lungs, and rise tube in position to drain secretions from the stomach, and a drain tube which is to drain the fluid from the abdomen. Post liver transplantation medications include Antibiotics, usually broad spectrum antibiotics will be using like piperacillin, colistin, teicoplanin, 𝑡𝑔𝑐𝑦𝑐line and meropenem. Antivirals like 𝑬𝒏𝒉𝒂𝒏𝒄𝒊𝒏𝒈 and 𝑦𝒐𝒊𝒏𝒄𝒊𝒏𝒈 are using for treating �cytomegalovirus and hepatitis B virus accordingly. And antifungal drugs include fluconazole, amphotericin B and echinocandin, and anticoagulation drugs are also will be used during the surgery, that is heparin and low molecular heparin. Then regarding the complications that is mostly happening after a liver transplant can be bleeding, infection, signs of rejection, blocked blood vessels to the new liver and leakage of bile or blocked bile ducts. Let's see the possible complications by week. Most of the time up to 6 months there can be chances for infection and signs of rejection. So during the first week there can be chances for primary graft non-function, biliary complications, acute kidney injury, infection that can be surgical or chest infections, and during the first to 4th week of surgery acute liver allograft rejection can happen, hepatic artery thrombosis. From the 1st to 3rd month cytomegalovirus infection, fungal infections, acute liver allograft rejection, biliary complications, hepatic artery thrombosis, hepatitis B recurrence can happen. And during the time of 3 to 6 months there is chance for acute liver allograft rejection, biliary complication, Epstein-Barr virus hepatitis, and over 6 months chronic rejection can happen, EBV hepatitis, portal vein thrombosis, disease recurrence, late hepatic artery thrombosis, post-transplant lymphoproliferative disease can happen. Now we are moving on to the important part, that is post-operative nursing management. During the intensive care unit stay, the patient will be staying at least for a week in the ICU. Ventilatory support will be going on for at least 1 or 2 days. Then patient will be under sedation. Continuous cardiac monitoring will be done, and strict I&O chart monitoring should be done during the ICU stay, and hourly drain output should be monitored. When according to the drain output, whether the patient need to replace with IV fluids or albumin, whether we want to give albumin, that we will our doctor will suggest according to the drain output. All medicines should be given in right interval. It is very important. And send all cultures like tracheal culture, urine culture and blood culture for for finding any pathogens. And LFT will be done, and complete blood count, PT and INR will be done for twice a day, and abdominal Doppler twice a day we will perform during the ICU stay, and every second hourly if our physician prescribes we will go for ABG analysis. Then dressing we will do only after 24 hours of surgery. Dressing we will do after 24 hours of surgery. Twice we will perform, and the TAC level, that is tacrolimus level, will be done 3 days once before taking tacrolimus tablet. Tacrolimus tablet is an immunosuppressant drug the patient will take throughout their lifetime after a liver transplant surgery. Then broad spectrum antibiotics will be using after the surgery. Then supplementary medicines will be given according to the doctor's order. All these are very important for easy recovery of the patient. Daily proton pump inhibitors like Nexpro or Pandosid will be given for the patient, and infusions like albumin, NAC infusions and electrolyte corrections will be going for the patient. Inotrope support for maintaining the MAP, mean arterial pressure if the patient is in need, and care of catheters are very important for these patients, and care of airway also important. And regarding the infection control practices, hand hygiene, which is the most important thing for every patient after a surgery. So in liver transplant surgery, it is a very risky and very important surgery. So it is very important for maintaining hand hygiene and universal precautions also we have to follow. Then proper use of personal protectives should be done. Care of catheters, drains, IV line, CVC and Ryle's tube should be done every day. Then surgical wound care is very important. As I said earlier, after 24 hours only we will remove the dressing after this transplant surgery and we will do twice a day. Then positive pressure isolation is required for the patient, and HEPA filter air is in the transplant unit. Then restrict visitors for avoiding infections. Reduce hospital stay and ask the patient to stay in a nearby accommodation for easily getting the care and the help from the nearby facility. And reduce chance of infection and antibiotic usage after a liver transplant. Biomedical waste management is a very important thing after a transplant. There are 5 golden rules for after liver transplant surgeries, that are hygienic surroundings, fluids and medications, regular follow-ups, diet and nutrition, and lifestyle and family support. Let's see one by one. The first thing is hygienic surroundings. So first thing is hand washing, personal hygiene, separate linen should be used for each the patient, and good ventilation should be there in the patient's room. Wear a mask at least for 3 months compulsorily. Then avoid visiting high risk areas. Now we are moving on to the fluids and medication, that is mostly regarding immunosuppression. IV fluids can be done with the doctor's order only till the diet starts, and if needed according to the drain output we will change, our physician will change accordingly. Never skip any prescribed medications, especially the antibiotics, which is very important. Compliance to the frequency is very important. Pain management, usually during the ICU stay, high effective painkillers will be given in the ICU. So once the patient is received to the ward means we will go for low doses like 500 mg of paracetamol, like that. Then no over the counter medications, no alternative medication should be given. Education on possible side effects and complications are very important, so that the patient can identify whether there are any signs of complications, and they will report immediately to the hospital. And regarding the diet and nutrition, the dietitian will prescribe a balanced diet. We also need to educate them regarding that. The safe drinking water, no added salt in the diet, enough fiber in the diet, follow low fat and fat free diet, can take lean meat, poultry and fish in their diet. At least 5 servings of fruits and vegetables the patient should take. Then avoid raw foods and salads without cooking. The patient should not take any kind of foods for avoiding some kind of infections. Avoid high sugar content. Avoid food that have interaction with immunosuppressants like grapefruits and grapefruit juices. The patient should never take the tobacco or alcohol after the liver transplant surgery. Now regarding the regular follow-ups. So the adherence to regular follow-up is very important, and wound care is important. Monitoring short and long-term problems are really important thing after a liver transplant surgery. Maintain a record of symptoms, contact of medical assistants. Regarding the lifestyle and family support, follow regular exercises like flexibility exercise and aerobic exercise, then muscle strengthening exercises. No heavy lifting should be done, and avoid direct contact cause injuries like or sports like football or wrestling. Swimming only can be done only after 3 months. Healthy lifestyle modifications can be done. Then motivation and psychological copying for the family as well as the patient is very, very important. Now we are moving on to the final slide, that is role of physiotherapy, which is also an important thing after a liver transplant surgery. So the physiotherapy aims to avoid complications of immobilization, respiratory support to prevent postoperative pulmonary complications, and restore functional independency. So these are the things I would like to share with you today. Thank you.